Good afternoon, everyone. We'll get started in 2 minutes.
Hey, Cindy, can you make me the host, please, so that I can stream this? Or Jared, who's ever started this. This is Sarah.
Sure.
Thank you. For some reason, it doesn't like me to have the controls. There we go. All right. All right, you guys are all set on Facebook.
Thank you, Sarah. And good afternoon, everyone. Welcome to the Calhoun County Joint Information Center briefing for Wednesday, June 2nd, 2021. Administrative notes. Next slide, please. Our unified command team. Next slide, please. Joint Operations Center lines of effort and priorities. Next slide, please. And the purpose of the Joint Information Center, or JIC. And next slide. Kicking things off today with a current situation report is Eric Pessel. Eric, go right ahead.
Hey, thanks, Dirk, and good afternoon, everyone. Just go through some quick slides here with some really good news. Our numbers are continuing to come down, although we've got a total count now of over 12,300. Our current hospitalizations are down to 9 in Calhoun County hospitals, and our death total now is up to 284. But I want to point your attention to that graph on the screen and the far right side. That's where we're dropping pretty precipitously now, which is good news. And that means that, this is the virus in our community is starting to come under control. As we move into the summer months and we're outdoors more, you would expect this to naturally happen at this time of year. I think also having a lot of our, over 70% of our seniors vaccinated helps. Hopefully if we can get more people vaccinated over the summer, we won't see an increase, another bell curve like this happen in the fall. We'll talk about that in a second. Next slide. So here's our, and I guess the second's up, here's our current vaccination numbers for Calhoun County. And this is to be in line with the state dashboard and the trying to get to 70%. This is only the 16-year-olds on up numbers. And you can see where Calhoun County completion is at 40% and initiations at 46% of our 16-year-olds on up. And I mentioned this in some meetings last week, but that's really poor in relationship and in comparison to the other counties in the state of Michigan. And we really need to dive into this and try to find out, one, why, Why are we hitting this wall? Why are people not wanting to get vaccinated? As I said, that picture in the previous slide, we're in good shape right now. My concern is as we get through the summer and we head into the fall, the weather turns cold again, we end up back indoors again, and those that are unvaccinated, I'm concerned about seeing another spike there. So if anything, our message right now is just get vaccinated. If you're on the fence, you should have enough information available to you by now. There's great information on our website and other government websites that give the facts of the vaccine. And hopefully we can continue to educate the community that needs educated and continue to promote vaccination throughout the summer months so that the fall will be a success for all of us. Next slide. And speaking of vaccinations, there's plenty of opportunities. Besides, this is where the Calhoun County Public Health Department is going to be operating over the next several weeks. You also can go to several different pharmacies. You can contact your local hospitals. Just about everybody between hospitals, pharmacies, some of your doctors will have access to vaccine, or at least access to information on where to get vaccinated. But beginning yesterday, both our Albion office and our office here at the Toller Building, we are offering COVID vaccines daily by appointment. You can contact us to get that. As you can see, we have certain days of the week where we're still going to do drive-through clinics. This week on Wednesday, which is today, I guess, from 3 to 6 p.m., we're going to be at the old State Farm Building in Marshall. And then 3 weeks from now, we'll be there again. And 3 weeks from then, we'll be there again. Tuesday, June 8th, we'll be at the Battle Creek YMCA. Thursday, June 10th, from 3 to 6, we'll be at Kellogg Community College. Again, that's one of our drive-throughs. Every 3 weeks, we'll be there again. Saturday, June 12th, Homer High School. And Tuesday, June 15th, we'll be back up at Mingus Creek parking lot in front of in front of the ABC warehouse. So there's plenty of opportunities for folks to get vaccinated. We make it as easy as possible. Try to do it at different times of the day to allow folks that maybe work different shifts. But really all you got to do is want to get it, come down, roll your sleeve up, get vaccinated, and then we can put this thing behind us. And with that, Dirk, I think that's it for my slides.
Okay, very good. Eric Pessel, thank you so much for your report. And the barking dog, apparently. Coming up next on the agenda, continued guidance with Calhoun County Administrator Kelly Scott. Kelly, take it away.
Thank you, Dirk. Good afternoon, everyone. Well, within the past week, we've received some new federal COVID guidance, as well as an updated MDHHS order that loosens the restrictions around masks and gatherings. And at the same time, the MIOSHA emergency rules protecting employees continue. So the dynamic of those three pieces of ongoing guidance is what I will cover today. The CDC updated its website on May 28, and they basically provided more detailed advice on how fully vaccinated individuals can continue most of the normal activities like they did pre-pandemic, based on what the CDC describes as their guiding principles. So the CDC is saying that based on a growing body of evidence as time goes on, they're currently saying that the vaccines that we have authorized in the United States are highly effective at protecting vaccinated people against symptomatic and severe COVID-19. They add that fully vaccinated people are much less likely to have asymptomatic infection or to transmit COVID-19 to others. At this point, the CDC is noting that the question of how long vaccine protection lasts and how much vaccines protect against the emerging variants are still under investigation. And just a reminder that for the purpose of this ongoing guidance, people are considered fully vaccinated 2 weeks after they've received the second dose of either the Pfizer or the Moderna, or 2 weeks after they've received their single Johnson & Johnson dose. So the CDC says that their basic guiding principles for fully vaccinated people are that indoor and outdoor activities now pose minimal risk for us. And for fully vaccinated people, we have a much reduced risk of transmitting this disease to unvaccinated people. Fully vaccinated people should still get tested if you're experiencing COVID symptoms, and you should not visit private or public settings if tested positive for COVID-19 in the prior 10 days or if you're experiencing COVID symptoms. So following those guiding principles, they also add that, there are still applicable other federal, state, local, tribal laws, rules, and regulations, and we should all continue to follow those. Also, so in addition to the CDC guidance, or in response to that, the governor has stated that the state of Michigan and our progress towards getting vaccinated has led to the MDHHS revising their gatherings and mask order. So starting yesterday, this will get us closer to reopening the economy and getting back to normal with these following rules. So as of yesterday, we no longer have capacity limits outdoors, no longer capacity limits at residential gatherings, and indoor establishments can now increase to 50% capacity. However, it will be regulated by the venue if you're planning a social gathering like an indoor wedding or a conference. That venue would have to calculate what kind of guidance they have on gatherings. And for non-vaccinated people, we are still required to wear face masks. And again, the state echoes the CDC in saying, this is the statewide mandate. However, local governments, businesses, employers, schools, anybody who owns a business and has employees or allows visitors to come in can choose to have additional face mask rules. The county is complying with the new MDHHS order basically by posting signage so that we are making a good faith effort to educate our employees and the public, indicating that masks are no longer required for fully vaccinated employees and visitors, except for within the courts and the court operated space within our Justice Center. The courts are currently evaluating their policies based on guidance from the State Supreme Court Administrative Office and with input from our County Public Health Officer, Eric Pessel, and our legal counsel. So that might change. Our employees are still screened through health screening forms or apps. So they're filling out forms indicating whether they have symptoms, what their temperature is, whenever we are reporting in person to county buildings. And within that screening form, we are asked to basically attest that we agree to wear masks and follow the continued mask mandate unless we're fully vaccinated. I also want to emphasize that there are still requirements for employers to protect our employees, even as the statewide restrictions are relaxed. MIOSHA still requires us to have our COVID-19 preparedness and response plans in place. County put one of those in place back in May of 2020, and we continue to revise that for updated guidance. And the purpose of that is to control, prevent, and mitigate the spread of the coronavirus among our employees. And so our plan will continue to include these required measures. We have engineering controls in place, such as proper ventilation and airflow. We have administrative controls in place, such as social distancing markings, plexiglass dividers, et cetera. And then we have the basic infection prevention measures, including increased facility cleaning and disinfection, the promotion of thorough hand washing. We're still providing masks and PPE to our employees as appropriate. I mentioned we're still requiring employees to do health surveillance before reporting. And so we're trying our best to keep sick people out of our buildings. And we continue to educate our employees through emails and updated training when needed. So we're continuing to support and protect our unvaccinated employees, knowing that as the rules are relaxed, we're really relying on personal choices to protect ourselves. So again, we're continuing to provide the necessary tools and help with social distancing from other employees and from customers. And we're encouraging anyone who feels uncomfortable without a mask for whatever reason, given their own personal situations, to continue to wear masks in county buildings. We're just not requiring it if you're fully vaccinated. And then, finally, beginning July 1, MDHHS says that all broad epidemic orders will be lifted. And again, once those restrictions are no longer in place, individual choices become more important to protect our own selves against COVID-19, including whether we get vaccinated or not, and if not, to continue to follow the guidance we've learned over the past year about wearing masks and staying distant from others. So as the pandemic winds down and more places reopen, all of the guidance still says, you're encouraged to wear masks in certain situations. The MDHHS outlines those, and there are certain situations where masks are still mandated. For example, masks are still required on public transportation per CDC order issued back at the end of January, beginning of February, requiring the wearing of masks by travelers to prevent the spread of the virus. And so the mandate also requires operators of public transportation to require everyone on board to wear masks when boarding, disembarking, and for the duration of travel. So in accordance with that, you'll note, as reported before, that the Battle Creek Transit still is requiring anyone waiting on the property to board a vehicle, including bus stops, to wear a face mask at all times. And the city is still required to follow the mandate for operators, meaning that if you refuse to wear a mask, it's a violation of this federal law, and it can lead to penalties as well as being denied a ride. And then the final point is that the CDC has also updated its guidance on travel for fully vaccinated people. That piece of their website was updated on May 28th. And the CDC is highlighting that fully vaccinated people can now resume travel without wearing masks or physically distancing, resuming domestic travel, and refraining from testing before or after travel, or self-quarantining after travel. Fully vaccinated people can also refrain from testing before leaving the United States for international travel, unless it's required by whatever country you're traveling to. And then refraining from routine screening testing if that's feasible. So just to wrap it up, anyone who is sick or still experiencing symptoms should stay home and stay away from people. The CDC is, again, reiterating that although the risk of fully vaccinated people becoming infected with COVID-19 is very low, any fully vaccinated person who still experiences symptoms consistent with COVID-19 should isolate themselves and should check with their healthcare provider and get tested if recommended. So, we should all consider that there is still virus spread in our community, even though the numbers are going in the right direction. And I think the way to keep those numbers going in the right direction is when we are all choosing our activities, we should consult websites like the CDC that give some nice infographics on how to choose the safest activities and which ones are more risky, indoor and outdoor, for whether you're vaccinated or unvaccinated, and based on who will be around when you're doing those activities. So, again, the federal government, the state government cannot anticipate the specific risk level for every activity in every community. We all have to consider our own personal situation and the risks of what we do to ourselves, our family, and our community before we venture out. And I see this as just all good news in, taking further steps to understand that we all have the tools to stay clear from this disease. And the more that we can contribute to the community as a whole, having a low level, the better that is to our health resources, and our health department and our hospitals can all get back to doing what they have been, and hoping to do some new projects to improve the health of our residents instead of having to respond to an emergency. That's it for my report. Thank you, Dirk.
Okay, Kelly Scott, thank you for the update and the information. We appreciate it. To discuss safe event attendance, We have Ted Deering, the Assistant City Manager for the City of Battle Creek. Ted, the floor is yours, sir.
Yeah, thank you very much, Dirk, and good afternoon, everyone. And I think this follow-up slide is it's a good follow-up to what Kelly was just talking about too. And as the numbers improve, which is certainly exciting, and as we see guidance change and we see some of the guidance that we've been under over the past several months lifted, restrictions lifted, and those kinds of things, it's pretty easy to get thrilled for the arrival of summer and all of the great outdoor activities and events that traditionally occur across our county, during the summer months. And many of those events, as we're seeing, are back on the calendar for 2021, including, what we expect to be a massive field of flight event over the July 4th weekend. And again, while those numbers are looking better, we have to be aware, as Kelly indicated, that the virus is still active in our community, and that it is important, as the restrictions are lifted, that we, as we want to head out for food and family and friends and fun, that we need to do it in a way that's safe for everybody involved. So, be sure and follow any guidelines that are set up by event organizers. Event organizers are still paying attention to safety, so follow those guidelines. That safety is put in place with you in mind, and the safety of all those who might be attending the event. Don't forget that if you're indoors, wear a mask unless you're fully vaccinated. And more importantly, again, as Kelly said just a minute ago, if you're sick, if you feel sick, if you have symptoms, please, I know it's hard, but please stay home. So, we're all excited again about a return to some semblance of normalcy in all of this. So it's appealing, but we need to stay safe. So please keep that in mind as you get out and about over the next few months. Enjoy the summer events, enjoy the opportunity to get together with family and friends, but do it in a safe way. Thank you.
Ted Deering, thank you for that report. We do appreciate it. Coming up next is the comments from elected officials, and we will begin with Senator Bison.
Hi, everyone. This is Karen in Senator Bison's office. He is in, I believe the Senate is still in session right now. So I have nothing new to report on the legislative side of the office that is COVID related. But on the constituent relations side, this is new to those who are on unemployment. The work search requirement has been reinstated as of this week, I believe as of May 30th. So if you are filing for the first time for unemployment, or if you are certifying your unemployment for the previous 2 weeks, the work search requirement has been reinstated. So you will have to report for the previous 2 weeks your work search, whether that is you've applied for a job, attended a virtual job fair, you've gone to an interview, and from what the UIA has told us on the weekly meetings with the legislative offices is that they want to know if you went to an interview, they want to know the name of the person who interviewed you, the place that you went to be interviewed, if you attended a job fair or virtual job fair, what the link was that you used to go to that job fair, and that they will be auditing the work search requirement reports on a monthly basis. So that is new, again, for this week, as of this week. And so if anyone who's listening has questions about it, you're welcome to call Senator Bison's office. And once again, I'll put his phone number and contact information in the chat. And that's all that I have. Thank you.
Okay, Karen, thank you for joining us today. We appreciate it. Representative Hodsma.
Hey, this is Paul from Rep. Hodgman's office. First day of session was this today. They didn't have session yesterday because of the long holiday. So he had his normal caucus meeting prior to session, wasn't able to participate, but nothing new other than that.
Okay, Paul, thanks for joining us today. Representative Hall. Moving on to county elected officials. Tribal elected officials. City elected officials. township elected officials and village elected officials.
This is Mike Alverson with the Village of Athens, and maybe Mary or Karen from Senator Bison's or Paul from Representative Hodsma's office can answer. Do we have an idea as to when the American Rescue Plan funds are going to be distributed down to cities and townships and villages yet?
Karen or Paul?
Didn't the county already get some distribution? And the city of Battle Creek got some distribution. I can look into townships. I didn't know they were on a different schedule, but I can look into that, Mike. I'm happy to do that.
Okay, that would be for the Village of Athens, so.
Yep.
Okay, Karen or anyone else want to address any of that?
Yep, they're still working on it, and I can get with you individually, Mr. Alverson, and give you additional information if you'd like. Thanks.
Thank you.
Okay, Mike, thanks for your question. And we'll move on to the next slide, please. These are our best information sources. And next slide, please. And our contact us page. Most of you should have. That'll conclude this meeting today, June 2nd. And we look forward to seeing you again in 2 weeks. I hope everybody has a great day and a wonderful week. Take care.